Hi, my name is Becky Hayward. I am the OSHIP Outreach and Education Supervisor. Today, we're going to look at Medicare.gov and how to navigate this website. So we want to log into www.medicare.gov. And this is the home page of the website. It is important when you are looking at a Medicare website that you put that GOV in there. Then you know you're on the government website. There's a lot of information right here on Medicare.gov. It's easy to use the search function to search everything that you need to do. But today we're going to talk about doing a plan finder. So looking up plans that are in my area that I might be eligible for. So on the home page, we're going to go to Find Plan Now, where it says Find Health and Drug Plans. We're going to click that green button. And what we're going to do today is a general search. You are able to make your own account, which does save some time, and there are some advantages to doing that. But today, we're just going to do a general search. If you called our OSHIP hotline, this is what we would use as well. So we're going to ask for your zip code. If it expands multiple counties, we're going to want to make sure we select the correct county, because plans are going to be based off of whether what county you live in addition to your zip code. It also asks you what type of plans that you're going to compare. We're going to compare today Medicare Part D plans. It also asks you whether you are eligible for any extra help. This is information you might know, you may not know, but today we're just going to go ahead and say we don't have any help from any of these programs, and we click Continue. So this is the page that's going to allow you to enter your drugs. So it's good to have a list of your covered drugs before you start this process, but we're going to go ahead and enter a couple medications just for examples. So we're going to go ahead and click Next, and I'm going to type in a medication. We're going to start with something pretty expensive, Xarelto, right? And what's nice about the program, it does give you a choice. So we're going to go ahead and pick that first one. We're going to add drug. You need to know the dosage. So what's the dosage? How frequently do you use it? We recommend that you do everything by month. You may get your prescriptions 3 times for 90 days, but we're going to put all of our information in here as if I take this medication once a day. So we're going to go ahead and add that to my list. We're going to add another drug today. I don't know the generic, so we're just going to go ahead and type the brand name. It's Lipitor. The system's going to let you know after you click Add Drug that there's a generic available. If it is a generic that I take, I'm going to go ahead and add that generic. And the last item I'm going to add, just for example purposes, is an insulin. And I want to make a note on this that we're going to go ahead and keep the brand name for the insulin. And I take that once a month. All right, so we have a small drug list listed in here. We're going to say we're done. The next page is going to tell us to pick a pharmacy. We can pick up to 5 pharmacies. Why is this important? Part D plans, whether they're standalone Part D plans or Medicare Advantage plans, use certain pharmacies, just like Medicare Advantage plans use certain doctors and hospitals. So you want to make sure the pharmacy that you use is in network for the plan that you're going to find that works best for you. We're going to go ahead and add mail order, because that might be an option that I'm comfortable with. And I'm just going to randomly pick some choices here so that we have a lot of options. Lots of options in this zip code, right? Oops. All right, so what comes up here? These are the Part D plans that are available in my area, which Part D plans are all available statewide. So these plans are going to be available for us for the whole state. So this is the same plans whether you live in this zip code or another zip code. So there are 20 options of Part D plans available to us. The website organizes this for us from lowest to highest cost based off the calendar year. So we are on this website in September. So this is showing us the best available or most cost-effective plans remaining in the calendar year. So it says right here for the rest of 2024. So this would be, if I enrolled today, it would be October, November, and December. If I was looking at this website during Medicare open enrollment, it would give me the option to look at the whole calendar year. So I might come in here in October and it will show me all of 2025 and my cost for the whole calendar year. So you are going to review and probably choose a plan that's going to give you the best cost for the calendar year. Or in my case, this person is going to be new in October. We're going to look for what's going to be best for October, November, December. And then this person might come back then again and review it for 2025 as well. So it organizes it from least expensive to most expensive. It's looking at premium. It's looking at total retail cost. If there's a deductible. So even though this plan, this Anthem plan, is $102.20, that's per month, it does say that it's the most cost effective. I'm going to go ahead and add this to my compare site. Here's another one. We're going to add that one. Oops. And I'm going to skip this one for a moment because we're going to do an example of a very low premium. Do this one. It's a lower premium. And we're going to go ahead and click compare. So it tells us, here's the plan name, here's the monthly premium. You can enroll if you want to. There's star ratings. These change each year. About mid-October, we'll know what 2025 plans might look like. Tells you that they have premiums, whether they have deductibles or not. Remember, this is for October, November, December in this case. All of our drugs are covered, so that's very important to know. But here's a great example right here. So I put 5 pharmacies in here to look at. They tell us they're preferred, whether they're in network. And when we look at this plan here on the right, they have much higher drug costs, even though their premium are lower. Here, right in the middle, this was our most expensive plan, and it tells us that their drug costs are lower. This cost is also going to include all of the premium as well. So if someone was interested in looking at that plan, we can go into even further detail. And this is what we do on the hotline, or if we were sitting with you in an appointment. We want to make sure all of the drugs are covered, all of the pharmacies that you like to use are preferred in network. It tells you what those drug costs might be for the calendar year, and what your price would be at each of those pharmacies for the rest of the calendar year. You can enroll right into this plan if you wanted to. You can enroll yourself into the plan to start the next month. So let's take a look at that. And there's your enroll button. What you need when you enroll is your Medicare number. If you have your Medicare number, you want to have your birthday. It'll also, and this is as far as I can go, whether I'm new to Medicare because I'm 65. If you were doing this during open enrollment, it would have a whole different option on there. But the folks logging in throughout the year are either new to Medicare or they have a special circumstance. So this is also something that we do on the OSHIP hotline for you if you would like that assistance and help. So that is an example of navigating the Medicare.gov website to look at Part D plans. Remember, you need your drugs that you take, you need to know the dosage, and you need to know how frequent you take them and a pharmacy that you might have. Maybe I don't take any medications, and you can certainly do that and look at plans. You could remove all of the drugs and then just go ahead and look at the Part D plans that are available to you. That makes a huge difference, right? So we're not gonna have any drugs, and the plans are gonna totally change for us. So it's gonna give us, again, the most cost-effective based off of my needs. So it does change based off the drugs that are in there. Next, we'll review Medicare Advantage plans. All right, so I'm going to remove my work, and we're going to start from the beginning again. So back to Medicare.gov. Here's my homepage, right? I'm right here. We're going to go back to Find Health and Drug Plans. So find plans now. My zip code is still there, but we're going to enter my zip code, enter my county, because we're doing a general search. We're going to hit continue. This time I'm going to look at Medicare Advantage plans. I still don't have any extra help, so I'm going to continue to the next page. And I removed my drugs, so let's go ahead and add a couple more, right? Because we still want our drugs in there. Xarelto, we'll go back to Xarelto. I'm going to keep that generic in there for the Lipitor. And let's go ahead and put my insulin back on there, right? All right. And remember, with my insulin, I'm going to keep the brand. There's a $35 copay for insulin, and you do want to make sure that is a brand insulin. So we're done adding my drugs. Again, I have to put in my pharmacies. And I'll show you a shortcut here that I didn't have to do that each time if I wanted to, but we're using this as an example. Okay. If you use a phone, this is actually very easy to use off of a phone as well. All right, so here is our Medicare Advantage plans in this zip code. Look at this. 81 options. Boy, that's a lot of options, right? So we're going to probably want to filter some of this information down so that we can view certain plans that might interest us more. We highly recommend, before you're looking at your Medicare Advantage plans, you need to review your providers. So what Medicare Advantage plans are my providers in network for? So I need to make sure, and then those are the only plans I'm going to look at because I want to keep my doctors. I have certain hospitals I want to see, and I want to make sure that insurance is within that doctor or hospital that is in my network. So I may be able to take some certain companies out of this list because I am just going to search for ones that are in network in my provider network. If you wanted to look at them all, they are all here, and you could probably spend hours and hours looking at them. But a lot of times we want to start with the ones I know my doctor takes. So the other item that you could look at on these 81 plans is to figure out, are there certain benefits I want? So I do want some extra added value benefits, which they generally all offer, and this is probably not going to change any, but I go ahead and want some of these added extra benefits that are here. I also want to make sure that I have an option to go out of network if I wanted to. So I'm going to only look at preferred provider organizations. So that's an option that lets me look at plans in and out of network. So I'm going to break that one down too. So now I'm down to 7. Not bad, dropping to 7 PPOs or preferred provider networks that are in my area. So I know that my provider takes Medical Mutual, so I'm going to go ahead and click that one. And it's possible these are all Medical Mutual, right? So let's do that one just to show it. And again, these are organized by the drugs that I put in there. So all the drugs that I put in here, it's organized from least expensive to most expensive based off the drugs that I take, because that's the only data I put in there. Let's see if there's anything else other than those two. Oh, there's an Aetna. So let's do that one. We have 3 different companies to review. Oh, the other one, I do also want to make sure we're going to make sure it covers drugs, all right? Because I want drug coverage. All right, so we're going to go ahead and compare our plans. Medical Mutual, Humana, and Aetna. So this looks very similar to when we compared the Part D plans as well. But it's going to give us a little more information because Medicare Advantage plans do more than prescription drugs. There's a premium. Tells you here's premium for that one. These don't have any extra premium. that tells you whether there's a deductible for your health services, whether there's a drug deductible. The other number you want to look at is this maximum out of pocket here. So even though these are preferred provider organizations, they give me the opportunity to go in and out of network. My costs going out of network are going to be higher. If I stayed in network, my total costs are lower. This is for health services only. This is not my drug services. This is my health services. Then it tells you how they break those premiums down. Everybody pays your Part B when you're in a Medicare Advantage plan. It highlights some of the plan features or the added value benefits. To get more detail on these planned features, you're going to have to go into each of these companies' websites. And then it breaks it down totally on cost. So remember, my maximum out of pocket is here for my health costs. And then down here, it's just going to totally break down every single cost that this plan does of what service I might have. When you're reviewing Medicare Advantage plans, the first thing you do is make sure my providers are in network. So if I want to pick one of these 3 plans, I need to make sure the doctors and the hospitals that I use accept this plan. All right, that's first important. Then I'm going to look at the cost of the plan, whether there's a premium. I'm going to make sure my drugs are covered by the plans. And then I'm going to look at the different costs when I use the plan. So what it costs to go to the doctor, to get outpatient services, x-rays, emergency room, inpatient stays. So it tells you all of that under here. It tells you what those, it gives you some details on the extra value benefits. As I said, you want to get further information from the plan itself. And then here are my drug costs. So this looks very similar to my Part D plan. It tells me whether the pharmacy I picked is in network or not. And then remember, these are my copays for the remainder of the calendar year. If I was looking at 2025 or for the following year, it's going to tell me for the full year. So a little more things you have to consider when you're looking at Medicare Advantage. But most Medicare Advantages look similar. But you need to first make sure my providers are in network, my drugs are covered, and then you're going to look at all the costs, and then you look at all the added value benefit. If I wanted to look at Part D plans and not go back to the start, I can do that. So I can go right here and click at all the Part D plans and see what those work for me. So you can go back and forth if you are shopping and still trying to consider how you're going to get your benefits. Maybe you're new to Medicare and you're reviewing Medicare Advantage versus Medicare Supplement, and this would be a way that you can do that. On my final note, if you are new to Medicare and you're looking at Medicare Advantage with a supplement in Part D or MedSup, with a prescription drug, you can call OSHIP and we can assist you for Medicare supplemental insurance. The Medicare.gov website does have some supplemental information on here, but the pricing isn't as accurate. You're going to want to call the plan directly. Now, again, to remind you, you can do all this yourself. You can, if you choose a Medicare Advantage plan, you do have the option to enroll right into a Medicare Advantage plan. The button is there and you can choose. If we're in an enrollment period or you're in your initial enrollment period, you have the option to enroll yourself into a Medicare Advantage plan. So that is nice with the Medicare.gov. Let's do one final video here. So Medicare.gov is our main website, Medicare.gov. Then you know you're on the government website, so make sure it's Gov. I highly recommend folks who are new to Medicare, maybe you've been on Medicare a while, maybe you care for somebody who is on Medicare, to make a Medicare.gov account. So there's a variety of ways to do this. We can only go so far in this video. We're going to create an account. And what's nice about a Medicare.gov account, it's going to show you your summary notice. It's going to show you your current coverage. You can add all of your medications and be able to do an easy comparison every year, so you can save all that information in there. You can also get your electronic Medicare summary notices. And what's nice about that, then, you can compare that to the doctor's claims, any bills that you have, review those notices and make sure everything is properly on there. To create the account, you're going to need need a Medicare card. You're going to put your Medicare number in there and your effective date. You can create the account whether you have A and B, or just A or just B. So that is an option. This is as far as that we can go. You will be asked to create a username, a password, and some secret code, right? If you ever missed that information. But it is an easy website to get into and navigate. It is something I like to keep for my parents, so I can monitor it. So it is nice if you are a caregiver of somebody and you'll be able to log into that fairly easy. So that is how to do a Medicare.gov account. We also looked at the Plan Finder for Part D and Medicare Advantage. You can also use this website if you wanted to compare providers as well. So lots of information that is helpful to you on the Medicare.gov website. And to remind you once again, make sure you're using .gov at the end, and then you know you're right there on the Medicare website. If you have any questions while you're on the site, I hear our hotline all the time talking to somebody saying, oh no, click that button. Yep, right there. You see that button that says Find Plan Now, and then you're going to put your zip code in. We're often navigating and assisting somebody who might be on the website at the same time using it. So I hope you found this information helpful.
For more information, contact OSHIP at 1-800-686-1578 or visit us at insurance.ohio.gov.